Yes, I think
That's
we get started. Maybe we can do a brief introduction, and then whoever join us later on, they can just catch up.
All right. So welcome everyone to our monthly meeting. So today is kind of a special meeting. We're each going to talk about our practices and our experiences with addictions and mental health in general. And so the three of us are Shelley Jo Wallstrom. She'll introduce herself, Salvatore, and myself. And we'll introduce ourselves, and then anyone can ask us questions. You can either put it in the chat or you're welcome to ask us questions. So it's sort of like an open forum today. Just wanted to let everyone know that next month we are going to have a speaker, Pam McKee, and she is going to speak about neurofeedback for addictions and mental health. And in the next few months, we're going to have a couple of other speakers. We're going to have a speaker every month. Our speaker probably in June will talk about alcohol use disorder and medications and other treatments for alcohol use disorder. Then we will have another speaker talking to us about the use of urine testing, urine neurotransmitter testing, and the efficacy for both addictions and mental health. So I think in general, we haven't been using neurotransmitter testing. And so a provider, a physician provider will let us know how, and she's actually works in a lab, and she will likely give us information about testing, urinary neurotransmitter testing. Anything else, guys, before we get started, Salvatore?
Oh, that's great. Sounds like we have a good lineup of exciting speakers coming up.
Yeah, if anyone has actually part of this forum, we'd like to ask the participants if there's anything you would like to hear about, any special speakers that you would like for us to have, or if you know of someone that we could ask to speak that you think would be great, that the members and the integrative addiction community in general would like to hear a particular topic, please let us know. You can email us through the Alliance, and we will give you an email. We'll put it in the chat shortly. All right, Shelley Jo, do you want to get started? A brief introduction.
Started that every time I kept clicking on my picture, it kept kicking me out and taking me back to my phone screen. So I was figuring out what the heck was going on. Oh gosh. Yes. I am Shelley Jo Wallstrom. I'm a certified addiction, recovery, and mental health nutrition coach. I'm also a certified clinical hypnotherapist. I went through a program through Christina Veselak to learn about the amino acids and how they work and why. And my story is different than a lot of people because I didn't come in as a therapist or a doctor or counselor. I came in as a mother of a daughter who struggles with addiction. And at the time, she had been struggling since she was 15. She was diagnosed with anxiety at age 6. And at the time, we did what most parents did. We got her on some medication, took her to a doctor, thought we were doing everything we could to help her to feel better. And it helped for a little bit until she came to me at age 15 in tears and said, "Mom, I'm tired of being a doctor's science project. I just want to feel normal." And those 6 words changed my life. I just want to feel normal. And I don't know if you've ever felt that way. I just want to feel normal. And for me, I was so sad because I thought I was doing everything I could at the time and didn't understand until she turned to drugs and alcohol. at age 15, which spiraled and got worse and worse until at age 21. We put her in a rehab center, thought we've done this, she's doing better, well, this will be it. She'll come out clean from drugs and alcohol. Yay. And then this will be a pass. And she did. She came out clean from drugs and alcohol, but she came out addicted to sugar, caffeine, and tobacco. Now, at the time, I thought, well, at least those are better than drugs and alcohol. I can deal with that. I thought we were going to be, this is great. She's done. She can set this aside. And 30 days later, she was introduced to meth. And at that time, it rocked our world because she became instantly addicted. That was her drug of choice. And it became very, very scary. My fear was she was either going to kill somebody, kill herself, or end up in jail. And after the first time she ended up in jail, I was actually relieved because I thought, yes, for the first time, I know where she's at. And I could sleep for the first time in years. Then at that time, she got out, and I thought, yes, if I ever went to jail, I'd never have to go back. So my thought was, yay, she had the desire, and I believe she'd stay clean. I believe she believes she'd stay clean. And I watch her, as just like white knuckling it. So one of the things I learned, there's 3 things I learned about those who struggle with addiction. First of all, nobody wants to be an addict or be addicted to anything. Second of all, they're usually just self-medicating for either something in the past or something in the brain that's not working correctly. And they're just white knuckling that, meaning they're just holding on and they don't feel good, but they're just wanting to stay clean. And I watched this pattern, and she'd do well for about 6 months, and then she'd relapse. And after her 4th time of going to jail, I thought there's got to be an answer. And that's when I started researching. What am I missing about the brain? What do I not understand that is making it so that she can't stay away from it? I also, as a hypnotherapist, I had clients that were just like, they come in, I'd work with them, and then they come back, and it was like 51st dates. So it just kept the cycle, and I kept thinking, what is it about the brain I don't understand? So when I took the class and learned about the neurotransmitters and the amino acid and how to feed your brain, it rocked my world. It changed my life and my daughter's. And I got so excited and started sharing this with everybody because I was like, what? You've got these really cool neurotransmitters in your brain, your dopamine, your serotonin, your GABA, and when they're working, they're fabulous. And when they're not so fabulous. And our brain, we have these feelings and these symptoms of anxiety, depression, worry, stress, lack of energy, and we turn to something to feel better. Sugar, starches, caffeine, drugs, alcohol, or behaviors, too much shopping, gaming, or gambling, pornography, because the brain takes hold and says, I want something to feel better. And by feeding the brain food, by feeding the brain specific amino acids, and feeding the body with nutrition, you can see once you get this honed in, that what it does, it helps to reduce those symptoms and those feelings, helps to reduce those cravings and those addictions. And I got so excited I started to share with everybody and wanted to learn more. So now I've written 2 books, Feed Your Brain, Change Your Life, Take Control of Your Brain, Body, and Emotions. From Crazy to Calm, Natural Ways to Boost Your Mental Health. Yes, I am a grandma. My grandson's right here. So, and I have my own amino acid line of supplements because I've seen such a difference that it can help that little child who is struggling with a tummy ache or unfocused, or the teenager who, they're so addicted to their phone and they're struggling in school to take tests, to their self-esteem, or that adult who's just white knuckling it and just holding on. And then I came to the Alliance because I felt like I could get more information, more support. And now I'm the chairman of this really great program, this nonprofit organization. There you go. That's a little bit about me. Plus, I'm a grandma, and I live in Utah, And that's it. Any questions? Should we go on and just introduce ourselves and then ask for questions? What would we want to do?
Maybe if there is no other questions, what I'll do, I'll introduce myself briefly. And then what I would like to do, since we only have about 5-6 participants, is will be good to have you, the participant, introduce yourself briefly and see what is your goal, what is your main motivations for attending these, and what you wish to get out from us today. Because, like Dr. Madhava mentioned, this is an open house that we are here for you guys and explain what is that we do in practice, but we also like to know how we can help each other. So briefly, my name is Salvatore Di Lilla. I'm a naturopathic doctor, board certified, and my practice is here in Ohio. I'm also certified for addiction and mental health nutrition level 2, and I did my concentrations in homeopathic medicine. Along with that, I also hold a regular meditation group bi-monthly, which has also helped not only the addictions, but not addictions populations that I deal with. And I'm also a Reiki teacher master for those of you that are familiar with energy medicine, such as Reiki and biomagnetism. So I have several tools in my toolbox that I bring to any of my sessions. I've been doing addiction recovery now in a city 20 minutes from here called Youngstown, Ohio, for a nonprofit group. We have sober living homes there. We do IOP, and I do a lot with the main pillar of naturopathy, which of course is nutrition, incorporating the amino acids and the therapy charts from Julia Ross, incorporating some of the other modalities, as I mentioned, for making sure that we get enough sleep, enough movement, drink enough water, and look at the body from a true holistic point of view. I always like to use the analogy of a three-legged stool: mind, body, emotion, spirit, because I think we need to feed all of them. Of course, we pay a lot of attention sometimes in some of the groups to work for example, the AA, which is a good group, but that's only one leg of the stool. We also need to pay attention to the mental health. We need to pay attention to the nutritions, and it is the complexity of all of them put together that I've seen really good results. So again, I am physically located in Northeastern Ohio. I have a private practice as well as doing addiction recovery in the downtown Youngstown for a nonprofit group. And I will be open to questions, comments, anything else that we could that we could answer today. Please let us know. Thank you.
Hi, sorry, I was in mute. So I'll introduce myself, and it would be great, as Salvatore suggested, that if everyone else could introduce themselves, maybe 5-10 minutes, whatever you want to say. So my name is Valsa Madhava. I'm in New York. I am a physician. I'm board certified in internal medicine and also board certified in addiction medicine. I've been working in the conventional setting in addictions for a long time. I've worked in the inpatient setting in a methadone OTP. I've worked in the jail system in addictions. I do also have a lot of experience with HIV treatment, HIV/AIDS treatment, and also a general internist. Then a few years ago, I got interested in functional medicine just as a way of looking at health. And at that time, I was working in an OTP in a methadone program, and a lot of patients who came in, the first thing they would say as soon as they were admitted for treatment with methadone was, when can I get off? And the whole idea in the conventional world of treatment for addictions is you sort of start with the medication and you perhaps stay on it for some length of time, perhaps years. And most of the individuals who came in wanted to come off of the medications. So at that time, I was already interested in functional medicine. And I thought, well, it would be great to incorporate, to look at the root cause of addiction, and then perhaps see how we can help individuals perhaps not be so dependent on medications. So that's how I came into addictions, sort of the integrative treatment of addictions. And what I do now is I actually take patients off of medications, psychotropics. And one of my specialties is helping patients come off of benzodiazepines. It's one of the hardest medications for individuals to come off of. They have a lot of, benzos probably affect a lot of different areas in the brain. So that's what I've been doing the last couple of years. And that involves actually a lot of testing and then a slow tapering. And I do also general functional medicine to some limited extent. So I guess that's about me. And you guys can definitely ask me questions if you want. But can we have you guys introduce yourself? Maybe the first one I see on my screen is Ginny Same. Ginny, are you available? How about Elise? Hey, you guys, you want to introduce yourselves?
I can
Paula?
go. Can you hear me? Okay, this is Paula Tanksley. Can you hear me?
Yes, Paula.
Hi, sorry, I don't have video today. Yeah, I'm a physical therapist and I am researching what you guys offer. I'm familiar with Julia Ross, and I have patients who have MCAS and I have chronic fatigue syndrome and lots of dietary issues, and often are on opiates and other, of course, lots of different medications. And so it's really great to meet all of you through this Zoom forum. Thank you very much. Some of them are just so sensitive that you can't just give them amino acids. Some of them have methylation issues and lots of food sensitivities. So I'm going to be interested to find out who likes working with that population. And maybe I'll make contact after the forum. That's my interest. Thank you.
Yeah, so Paula, actually that's a very tough group of patients, right? Group of individuals.
Yeah.
Because what they have is whatever the root cause is, it could be like a chronic infection.
Mm-hmm.
It could be toxins, whether it's mold or chemical toxins or any kind of toxin. So chronic infections, toxins, COVID, being a chronic infection. So all of those can sort of make a person more sensitive, like as you were talking about mast cell activation. And when you have the mast cells that are activated, they release these mediators that can cause a whole bunch of symptoms. And so the highly sensitive patient may or may not have this mast cell activation, but that's one group. But often these patients have limbic system and vagal system dysfunction. I don't know if you've heard of those.
Oh, yes. Oh, yeah.
So
Yeah, it's just finding whatever doorways I can explore and just becoming aware of them, because sometimes it's just trial and error. But you're right, that is the biggest problem with the ME/CFS crowd. It's still under research to find the best doorway in.
Yeah, so a lot of that is actually mitochondrial. When you look at like when someone has chronic fatigue, basically it's the mitochondria that are not working well. And so that mitochondria are these organelles within cells, and
I'm
they're
aware.
responsible
Yeah.
for creating energy. And so if these organelles cannot create energy, the first thing you have is fatigue because you're not able to generate enough energy. So
Right.
that's another. So I do a lot of testing, and I find universally in patients that come to me, probably 90% have mitochondrial dysfunction. So that's also there. There's also this MCAS mold, chronic infections. So you have a lot of different things going on, as you alluded to earlier, that's sort of keeping the patients in this chronic sort of milieu of not feeling well. And, which is more predominant, and how do you really get at it? Like if they can tolerate supplements, I think it's a little bit easier because you can probably give them something and then get them, diet, foundational, of course, is diet, and then get them something to, find the right ones to probably move them a little bit. But if they cannot tolerate supplements, then fundamentally what you have to do is address the vagal system and the limbic system. That's the first. I mean, it's sort of these systems are protecting the body from what they think are harmful supplements or harmful agents. So
Thank you for that.
yeah. So yeah, it's a difficult group. It's just impossible. And the expectation sometimes is that the patients want that magic pill. And
Yes.
it's a layering. It's going to be, I think the expectations have to be set forth in the beginning. And just, I want to put it out there, like you can also, I just want, at least with the benzos, I think it has direct toxic effects, mitochondria or the mast cells. So I'm not sure. This is just my theory. Why not opioids, right? Like, can they have similar effects? I don't know. For some people who are genetically susceptible, can they also, can it activate their mast cells? Ironically, with benzos, we give benzos for mast cell activation. And now we're saying that, in fact, benzos are not calming the mast cells, it's activating the mast cells. So just something to keep in mind. So these patients in general are complicated, as you know, and it's probably like a layering that kind of a layering way of looking at these patients to get them to health. And the expectation needs to be that it's over years, right? Depending on where they are in the spectrum, right? As I meant spectrum of complexity, like where they are in the spectrum of complexity. Yeah.
That makes perfect sense. I guess what I'm interested in is who on the panel feels comfortable dealing with that crowd in case I have a referral.
I don't know, Salvatore, do you feel comfortable with that group of people?
Yeah. Yes.
Yeah. So either of us, Salvatore, myself, I'm not sure that Shelley, do you feel comfortable with that, with the patients with mast cell activation or with chronic infections?
I would probably turn them over to either you or Salvatore for that. I'm going to be more, I'm spending more of my time in the prevention. So if I can help people feed their brain before they get to the point where they're turning to addiction is where I do my best. I've worked with several who have the MTHFR gene, and I do work with those. But if it's going to be several different things, then probably one of you guys would be better.
So yeah, we're
Yeah.
around. Either Salvatore or myself can probably help you or refer patients to us.
Yeah,
Well,
we'll be
thank you.
glad to work with you. Sure, thank you, and thank you for bringing it up.
Yeah, thank you for being so direct. Appreciate it.
Denver Chill, Elise, or Ginny, would you guys like to introduce yourselves?
I know there was something in the chat as we waiting for the shy people to come forward. There was something in the chat about insurance and how to cover for some of these things. I think Jenny might have mentioned that. Yes, you are correct. These things are often non-covered by insurance, and it's out of pocket. And most of the people that we see are on Medicaid, so they don't really have a lot of extra spending dollars. What I found out in my organizations, we were able to assure some of the grants that were given just to get us started. And then what we do is we hold these people responsible. So even though some of the amino acids might cost $25, $30, at our cost, we ask them to pay a $5. So whatever they purchase, whether it's a probiotics of $70 or amino acids of $20, the out of pocket is only $5. So this does a couple things. It holds them accountable, I think, and it makes them more responsible, because rather than just give them away, where sometimes they don't appreciate it as much, or they may not think of the value, but then they start with that. They start, we start going where they start taking these things, these supplements. They start eating better. They start feeling better. And in my opinion is nobody gets up in the morning and does not want to feel good. So once you start feeling better, it becomes one of those evolving doors that you keep going around because you want to better yourself. So if today, out of 10 to 1, that you were on the 1 scale, and tomorrow you're on the 2 or 3, then you're eventually gonna progress because you're gonna start seeing the benefit for yourself.
Yeah, I agree. Like, I think amino acids in general, yeah, they're not covered by insurance, but if someone can afford a few dollars, then that would be great. Then they can pay it out of pocket. But in general, I think what's happening in the society is that for any illness that folks may have, the idea is there should be a medication for it. There's no thought about addressing diet or addressing natural agents. So I've been at meetings with the NIH and NIDA, the head of NIDA, and which is the National Institute for Drug Addiction, which is one of the premier agencies in the country. It's the lead agency. And I was in the audience with her, and I was sort of saying, can we have more nutrition focused research? Just research. And she was not open to it, right? Like, if we don't have even funding going into research for things other than medications, then it's going to be hard to get the addiction community to get behind nutrition. So it might be up to the consumer, up to the people who have addictions or people who have mental health conditions to sort of insist on another way of treating their problem. And actually, there is a movement, especially in the mental health community, there are a lot of people around talking about the metabolic causes of mental health. So talking about the mitochondria as being the root cause of mental health issues, then talking about the keto diet for treating mental health issues. So there is a movement, a pretty prominent movement, like people from Harvard and Stanford, these are the leaders, but they're not the leaders like where the funding comes from, like the NIH. But we have leaders in some of these universities who are talking about use of metabolic therapies, ketogenic diet as a way to approach diseases. So just to let you know, even though it may not be coming from the NIH or NIDA or the NIAA, which is the National Institute of Alcoholism, they're not involved. But at the intermediate level, at the I guess some of the medical schools, they're at least sort of looking maybe not at addictions, but mental health and addictions are the same spectrum, right? There's not that much difference between someone who's using a substance to make their brain feel better or using a medication to make the brain feel better. There's not that much of a gap. And so anyway, there are many people involved in this. I think there is going to be some changes over the next few years. Lots of people out there. So if you search them on YouTube, you can find people who are really looking at mental health as metabolic health. So anyone else that want to introduce themselves? Let us get to know you better. Or ask us any questions that you may have. Elise or Denver Chill, Mary.
Well, maybe I can speak for some of us. I'm just new to your website, so I have no idea. I'm just listening to learn. I haven't even had the opportunity to explore your website. So I can't even ask an educated question at this point. Just know someone struggling a lot with addiction, where I think nutrition and some supplementation would be very advantageous. And so just trying to learn more information about what's available and how one would actually get started on a course of, I think I heard it referred to as a pro-recovery. Is that ringing a bell? Diet or something?
Yeah, pro-recovery diet.
Okay.
So what so that's foundational, is a pro-recovery diet is foundational, where we're moving away from some of the standard American foods, where we're really
Right.
concentrating on increasing the protein and frequency of protein intake throughout the day. And that's foundational. And then layering on that, I think Salvatore mentioned the three-legged stool, really talking about that. And then the psychological, the social aspects also need to be addressed. And perhaps, other aspects have to be addressed. But that's foundational. What kind of issue is it? What kind of mental health addiction issue is it?
Alcohol.
Yeah. So for
So
alcohol,
you
actually,
definitely see, I definitely see the low blood sugar, the effects of not eating, it just all the things that you might expect, but.
yeah. So there's a book called 7 Weeks to Sobriety.
Mhm.
It's a really good book to get by
Okay.
Joan Matthews Larson.
I think I have that written down. Yes, I came across that.
Yes. And so foundationally, almost 100% of patients who use alcohol have low blood sugar for various reasons. And so that's why we would recommend eating every 3 hours, high protein diet, not, trying to avoid carbs and sweets as much as possible, even though that might be hard. Might be a transition, right? It's not, you can't go from one day to the next. And,
Right.
doing that, and then using nutrient supplements depending on the root cause of their addiction. Oftentimes we have genetic susceptibilities to everything, to diseases, to addictions, to so-called mental health issues. And so we have to help the individual overcome their genetic susceptibilities. That's the use of targeted nutrients and supplements for that. So that book goes into some detail about alcohol addiction in general
Sure.
and all the different kinds. And of course, our website, if you're a member, you have access to certain areas on our website.
Well, and maybe explain that for me if you would. I saw, the option to join, and I just didn't have the time to, see what are you joining? What do you get for the, as part of, when you join? Maybe just explain that briefly to me.
Yeah, Shelley, do you want to talk about that a little bit? So the three of us are on the board of the Alliance, and Shelley Joe is the president.
Oh,
So-
okay. Okay.
Hi, if what we want to be is a resource, either for somebody who's struggling with addiction, somebody who loves somebody who's in addiction, or somebody who works with those in addiction. And so there's 3 different categories. You could become a student, you could be just a regular member or a professional member, depending on what it is that you're looking for. And what that is, it's a resource. It gives you information that you may not see in other places.
Okay. Okay. Thank you.
Yeah, and then we have we have these monthly sessions that are recorded that you'll have access to. And then and we're also trying, depending on what you want, what the members want, we can provide, we're pretty flexible. We can provide the kind of services to a certain extent, what you may want. And that was part of this session, is to sort of get an idea of what people may want. And it's not a one-time conversation. It's something that we can talk about over, the next months.
Right.
So just sort of to get that conversation going. So we're trying to, be available for.
Do you provide resources then for like nutritional testing? I mean, once you kind of get the basics of, the higher protein, limiting the carbs and sweets, and, to take a look at what amino acids one might need, what supplements to take, how is that determined?
So we have Christina Veselak, and all 3 of us trained with Christina Veselak. So
Okay.
she has a training program that's called the Academy for Addictions and Mental Health Nutrition. So she has a certificate program, really good program, and she has level 1 and level 2. So that's how a lot of us got trained on how to use amino acids for different addictions and mental health issues. So
Okay.
she would be someone that you could explore to train with. And she also has sort of open sessions that you can find out more about. So it's the Academy for, I think her website is called amino acid. What is it called, Salvatore? Do you remember? Amino acid, something amino acid. I'll put it in the chat, okay, as soon as I find out. But
Okay.
anyway, so she
It used to
has
be the Academy for Addictions, but it is the amino acids site basically. And just like you were saying, and Shelby Joe was mentioning, we want to be a resource. So, and everybody can take something away from it, whether you are a user yourself, or you're a professional, or you are excuse me, a parent or loved one that has been struggling with addictions. There is something that amino acid therapy, that's it. So that's it's in the chat right there. And if you don't feel like, getting certified and going through the whole level of certifications, there is still enough resource that you can get just by becoming a member, networking with all of us, looking at some of the resources, some of the books, some of the studies, some of the supplements that we use, some of the testing that we're using. For example, I used a hair analysis just to take a look at the imbalance for minerals and toxic elements. I also use dry urine for neurotransmitters. So all those things, along with questionnaires that Julia Ross has put together in the website, where we can see where the deficiency come from, and we can see what we can use as far as amino acids or some of the other supplements to to boost them up and to put them back to a regular level. So it's really a great resources, and our goal is really to educate people that we even exist. Because so many times, if I'm giving a presentation or talking, people aren't even aware that there are other alternatives other than prescription meds to wean off people their substance and to get back to a normality.
Yeah.
Well, this is where I'd like to kind of give a little bit of a thought here. I want you to see it as not an either or, but an and. So when you start into this process, it's not like you don't just go off what you're doing to get better. It's how can we support whatever somebody wants to get off of to raise their nutrition and their feed the brain. Is there emotions attached to it? That's why I do hypnotherapy. Just like Salvador said, it's brain, body, and emotion. So you're hitting all three of those and figuring out what that looks like, rather than seeing it as I'm gonna have to throw everything away. Because when you start to raise those neurotransmitters, it makes it so it's much easier when you're working with a doctor to start to come down off of some of those medications. Somebody asked about how to get off of venlafaxine. That is an SNRI, and that is one you'd want to be careful with as far as, because it does raise serotonin. So you wouldn't want to take the amino acids 5-HTP and tryptophan at the same time. You want to have at least 4 to 5 hours away. But it's just, how can we support as you are changing your lifestyle, learning how to eat better, not just coming off of whatever you're addicted of and thinking that you're just going to switch over and feel better.
So to add to that, if someone is using a substance, say in this case, it's an SNRI, which boosts up both the serotonin and the norepinephrine system. So when someone is using a substance, it's because at some point they felt they needed it. They didn't have enough serotonin or norepinephrine. But what happens with continued use is that it stops becoming effective. So in fact, you've used up your serotonin and norepinephrine that you've boosted initially. So now some of these substances have actually, the medications have changed the brain, just like substances that we use have changed the brain. So in fact, it's for a certain percentage of the people who use it, it's kind of difficult to come off. So we don't know who's going to have difficulty coming off and who's not. So part of what Julia Ross's books, which actually she's the leader in talking, she started in the 1980s. So she's the leader in talking about use of amino acids in addictions and mental health, just like Dr. Charles Gant, and also there's Dr. Charles Gant, Julia Ross. There are a couple of the people who are the pioneers in this. And what Christina Veselak from aminoacidtherapy.com, what she does is she actually tells you how to do it. Reading a book might be useful, just like I referred you to the book on for alcohol use disorder. Just like that, reading books might be good for many people. They can take the advice from there and try to do it on their own. But for those of us who may want training, like we're all health practitioners and we want training to be able to help people. So for us, the training is helpful. And for individuals who might just want to go on and learn more, you can just go to her website, aminoacidtherapy.com. And as Salvatore was saying, there's a lot of information there. Just like there's a lot of information in the books. Julia Ross's books are awesome. It'll be very helpful, and I think she has guides on how to sort of help the individual, with whatever issue they may have. So I don't know if she addresses SNRIs in particular, but what I would say is you can look at those books, you can look at the aminoacidtherapy.com, but it's, that's something you could try to do, but just knowing that probably both the serotonin and the norepinephrine, which are neurotransmitters, are depleted is one of the ways of looking at how to sort of compensate and get yourself off of it. I think someone wrote, it sounds like the body of work has expanded somewhat since Julia published too. I think her books are actually very relevant. I don't know that it's necessarily, I think it's still very good. It's very relevant to how we all, practice with amino acids. It's still highly relevant. I would just say that Christina makes it more practical. You get a certificate when, if you're a health practitioner, whatever her requirements are, she actually goes through all of the amino acids with you, all the relevant amino acids with you, talking about why it's important. And yes. Okay, so Paula asked, is there a central place where I could send patients to look for a provider for amino acid therapy? I think she has a list of people on her website, which is the aminoacidtherapy.com. There are a list of people on her website, people who've gone through her training.
Well, and then on our website, there's also a section as a member that you can, that there's some therapists that are on there that you can look for somebody that would work with you or help you. I know that, is it Mary that is asking for a help provider? Either one of, all three of us are able to help when it comes to amino acids and nutrition. That's what we've all been trained in a little bit. And then everybody else has their own specialty as far as where you go from there, what that looks like.
Yeah. I think the message that we want to give is that, that there are other possibilities besides medications, that if someone is on medications, we can, depending on, I think the foundation is we're all have certain genetics that we're born with, and we have had environmental exposures throughout our childhood, whether it's trauma or the kind of diet that we have. And so our bodies have changed and make us more susceptible to different kinds of health conditions. And certain people have mental health or so-called mental health or brain-related conditions. And so we can sort of direct the individual to a more foundational point of view where eating the right kind of diet, focusing on perhaps exercise and some of the emotional and social aspects of good health, which is where we focus on. And if someone happens to be on medications, we can, we as a group can probably work with that individual. And ideally, as Shelley was saying, she would like to be more on the preventive aspects, maybe not have kids go on medications. And so when someone has anxiety and depression, is to even prevent that step. Like, don't even get on medications. Let's see how we can help your brain so you don't need that. I don't know. Do you guys have anything to add?
Well, I do, because when I first took it and learned this information, I actually was angry because I thought, why didn't I know this when my daughter was 6 and struggling with anxiety? She may not turn to drugs and alcohol at age 15. That's what got me passionate to learn more, because there's so many people out there that are looking for help and there's no resources except for medication.
And Elise asked, are there any functional neurologists that specialize in helping individuals taper and regulate the nervous system and safely move out of the cell danger response? So I don't know. I sent a patient to a functional neurologist, and they did a lot of work. They actually did almost 5 days of work on her, and this particular individual could not take any supplements. She probably had MCAS or some sort of perturbation that she was not able to take any supplements, and she came out of it. She went there for 5 days, did not change a thing for her. I was so shocked because I was hoping that we could at least move the dial a little bit so that I could start with the supplements. And she's come back to me with the whole functional neurology experience, having helped her minimally. So I don't know if the functional neurologist, maybe that's just one experience is what I want to say. Maybe there are other functional neurologists who might be able to do this, but I think the cell danger response, right? Like that's very complicated. It's really, I don't know if it's in the functional neurologist realm. I don't know.
Right. So that Dr. Valsa, we actually spoke, I don't know if it's a year or 2 years ago. I am a naturopath, but I have post-traumatic epilepsy. I live in Canada. We had spoken, and I've actually spoken to one of the well-known functional neurologists out there who say that he doesn't get results unless the PTSD is addressed first. So that's probably why your patient, or calm the nervous system or something, like it wasn't, that layer wasn't addressed before doing functional neurology practices. That's my sense.
So yeah, exactly. But she went there to get that calmness, right? Like they have different modalities.
Yeah, so that functional neurologist should have said, get your trauma addressed first, because it'll help your progress will be much better than if you don't address that first. Like that's the first layer of the onion.
Yeah.
Which is tricky.
So, yeah, like she doesn't think she has trauma. Like when they talk to her, she does have a lot of stress. When I checked her neurotransmitter, she had like high norepinephrine.
Right. So like you have to regulate the limbic system, like you said, and make sure the vagus nerve is functioning. So that's where it's so tricky for me, because I don't know my window of tolerance, and doing too much vagus nerve toning, even neurofeedback, even does absolutely nothing or completely sends me over the edge, activates the stress. So it's almost like I need someone outside the functional medicine box almost.
Yeah, I think it's iterative. What I've come to realize is that you have to move the dial a little bit, right? Like whatever it is, and then you come with another modality, then you do another one. So it's what I said in the beginning. Cannot, at least for the 5% of patients is how I describe that group. For the 5% of patients who have this difficulty, it's iterative. You do one thing, then you do another, then you do another, and it's a lot of testing. And I don't mean testing in that way, not in terms of doing like blood urine testing. I'm talking about testing different supplements. Like Salvatore is excellent with homeopathic treatments. So maybe homeopathy might be a way to approach this, right? Like maybe we need to do a little bit of, limbic system. And then for some people, it's not working actually, the limbic system.
Right. So limbic system at some point was really helping me taper. I was regulating, doing a little bit of polytasking, alternate nostril breathing, a little bit of humming, and then it just was too much. It's like, so it activated the stress response. So it's like, it's really a slippery slope. It's almost like I wish somebody could not muscle test, or someone who's very connected sort of in the quantum world. We can sort of use that word today. It's not woo anymore.
So maybe
Elisa, where are you at in Canada?
I live in Montreal.
Montreal, okay. The reason why I'm asking is because I have a couple of my colleagues that are in Canada, one of them in Montreal, and she's also an homeopath. So I don't know if you have tried that field, and she was trained in classical homeopathy as myself. So there may be something else to look into, and we can definitely talk more if you wish to, after the sessions.
Homeopathy from my experience, because I guess I'm familiar with the UNDA system as well
Mhm.
as a little bit of homeopathic stuff. But someone had given me my constitutional remedy probably 15, 20 years ago, and it completely activated myself.
Mhm.
And I've also, like, from Datis Karazian's work, it's almost like if the brain is neurochemically challenged, then it's not, it doesn't do anything. Just like Reiki or acupuncture, my pulses never change.
Sure. Yeah.
Interesting, very interesting journey.
Yeah.
Yeah.
So Elise, I have a comment because this is where,
And I take
like I
amino
said
acid
before,
supreme every day, all the
I
time. Very good. And I did notice a change in in how the frequency and the sort of, but how much of it is getting absorbed? How is the vagus nerve not working enough? Because I don't feel much from supplements.
And that
so
was the
Elise,
reason
I'd be
why.
interested. Oh, sorry, Salvatore. I would be
Um,
interested to see how much the emotional is so important. That's why I do hypnosis with it, is
Totally.
because I want
Well,
to
I
get to
call it,
the
it's post-traumatic epilepsy.
right,
And
get
it's
to
one
the
of the
root of
only,
the problem.
right. But then if the unconscious isn't ready to go there, having a grand mal seizure creates more traumatic brain injury, which is not like I don't want to re-traumatize. So it's almost like this catch-22 situation. It's like finding the safe way in safely. Because cultivating safety is in any trauma is first and foremost.
That's the polyvagal theory, right? Like cultivating
Right,
safe.
right. And I've even used his safe and sound protocol, and after one treatment, it's activated. I'm so sensitive, and yet it's crazy.
So I just wonder, I know Salvatore wants to say something, but neurofeedback, we have a speaker next month who's going to talk about
So
neurofeedback.
neurofeedback, I guess they didn't know how much is too much. Completely grand mal seizure.
Yeah, so you have to do very low. We're talking about 20 millihertz, like very low, the
Right.
lowest. So just even like the lowest at like 1 second, like that. Like just,
I know.
and then work up. But again, she's going to talk more about it. And but I tried it with a couple of patients, and they're able to tolerate that level, that low level.
Right.
And
Sorry,
I was
Salvatore.
gonna add, no, that's okay. And I was gonna add to when you mentioned that, I think you said something like 15 years ago with your constitutional remedy. It is not uncommon sometimes with homeopathy, as you know. I think you used the analogy of peeling the onions, and it is just that we got to go one layer at a time, like peeling the onions.
Right.
And it's not uncommon. Sometimes you might find the right remedy, but not necessarily the right potency, and that could have been the factor that threw you into a loop there. So I won't just throw everything out just because, and like Vasa was saying, with the neurofeedback, maybe it was too much, just like the potency for your constitution might have been too much, and we needed to scale it down a little bit more. But I
For
think
sure.
that, yeah, there are other things that I would not totally give up yet.
No, I'm not giving up yet. I'm
Good.
really working on my circadian rhythm
Right,
and
right.
greens and increasing hydration
Yeah.
and getting more
No, and I
heat
didn't mean
push.
giving up, but just like in a sense where you have tried some of this modality and the response was not as positive as you had wished to it, but it might have been that it's not so much the modality itself, is how it was administered.
Sure. No, when I changed my diet like 20 years ago and started, doing certain things, like from being on so many anticonvulsants back in the day,
Mhm.
it definitely helped resolve my constipation.
Sure.
But I'm sure, like, the tests have shown I'm missing 6 classes of bacteria. So, whether that happened because I was breech forceps or at age 9 went on huge amounts of anticonvulsants, which I'm practically off now and had no withdrawal symptoms. So it's just this traumatic brain injury that I want to resolve that created this insomnia. And I'm just don't want to take any medication anymore.
And
I've developed a tolerance to it already almost. So it's almost like there's no point even increasing, and I'm not even looking to go towards the Ashton manual and take any like other medications. It's just like, let me try to regulate my nervous system, my circadian rhythms, get more time spent outdoors, more protein, more fat, salt baths, remineralize, just try to, and then address the toxins.
Right.
Well, and Elise, I want to add too, I know you mentioned something about you don't want to re-traumatize, and that I can totally understand that. And finding somebody that can help you to get to the emotional and to be able to heal that, it's the same thing. It's still one layer at a time, but it doesn't have to re-traumatize because you've already lived through it. You're just you've survived whatever you've lived through by, getting to the root of whatever that is and healing that trauma.
Right, but if there's a resistance to that, it's like somebody, a therapist, unless they can tune into my unconscious, can't know, when it's going to be too much. And it's not like I haven't tried therapy. I certainly have, tried connecting the dots, but there's this unconscious resistance that is so much now closer to the surface, and it's just finding the right recipe safely.
yeah, it sounds like you've done a lot of work. So
Absolutely.
yeah, it sounds really good. And someone asked, Mary Lalonde asked, how long does it take for the brain to come back to normal, whatever that is? It depends on the individual and where they are at. Some people, it'll take just a few days, for others, months. And for other people, like the 5% that I have in my population, it's going to take a long time because there are a lot of imbalances that we don't even know what they are. And the process is iterative, right? Like someone who has a cell danger response, or someone who has these like MCAS or ultra sensitive to supplements, those individuals, it's going to take a long time because the process is very, very slow. If you can't tolerate supplements, it's going to be very slow trying to find the gateway and then working on that. I think someone mentioned gateway, working on that, improving that, and then trying something else. And then it's trying and then addition. So it can take a long time depending on the individual. So some people, like I've had patients who take a few supplements and they are great. They are able to taper off their medications within a month. That's the exception. Or they can stop their medications, just abruptly. Then there are others who will take, I think for them, it'll take years. It's not going to be easy. I think that's my experience so far. All right, guys, it's 3:08. If there's nothing else pressing, it's really nice to have all of you here. Please come back next month where we're going to have Pam speak to us on neurofeedback, microcurrent and neurofeedback for brain health. All right. Any last words, Shelley, Salvatore, anyone else?
I just want to thank you guys for coming on here and doing something.
Yeah, I want to thank everybody for coming out. And please, if you have any questions, don't hesitate, or anything that comes up in the next couple days that you thought you should have asked and you didn't get a chance
Salvatore,
to.
do you want to put that Montreal person in the chat?
I can, or if you give me your email, I can email it to you personally, whatever it's easier for you.
Okay, do you want me to put that? I'll put that in the chat now.
Please, yeah, if you can put it in the chat now, then I will email you privately.
Great, thanks so much.
Sure, thank you.
All right, guys, thank you very much for attending, and we hope to see you in our future monthly educational sessions.
Keep shining your light, guys.
Thank you.
Thanks.
Hey, Salvatore and Vanessa, can you guys stay on a minute? Thanks, guys.
Yeah. Hi, thank you. So let me get this email over here that I wanted to copy. So I'll leave it for Lisa. Okay. Perfect.
Okay, awesome. Okay, so that was great. And I apologize, my granddaughter this is nap time. It is really difficult. So I was doing the best I could as far as not leaving anybody to, so you couldn't hear anything. But I'm just curious what your guys' thought about the